Millions of Ontarians are fully vaccinated and have complied with previous restrictions. But 20 months into this pandemic, will reimposed restrictions work? Will people follow them? Dr. Peter Jüni is the scientific director at the Ontario COVID-19 Science Advisory Table. He's in Toronto. Dr. Jüni, thanks for talking with us today.
Thanks for having me.
So you and your fellow colleagues on the Science Table are calling for circuit breaker public health measures to reduce contacts by 50%. What exactly would that look like?
Well, it looks more like, having all the settings where we know that transmission happens, like restaurants, bars, clubs, but then also cinemas, etc., where people stay for a long time, just have their capacity limits imposed, to 50 or 25% of the regular capacity, to make sure that this is not crowded anymore, and making sure in all other places that people really are able to consistently wear their masks. Retail is much less of an issue if you don't crowd in large big box stores or so. This will be less of an issue. So things can continue, even though we just need to distribute ourselves more so that we have less contacts. That's important. It also includes, of course, working from home. People who can work from home, they shall work from home. That's one of the other aspects.
So just to be clear, because earlier in the week we heard about the half capacity at places with 1,000 people and up. You're saying that's not good enough?
Oh, this won't do anything for contacts. The contacts won't be decreased because of that. It will be important to do it because it will perhaps do something a little bit for super spreader events, but this will be just a little drop on a hot stone, nothing else. And we need to be aware of that. It's important to do it because we can't tell people, not to gather in with more than 10 people or so, and then at the other end just have, also for psychological reasons, just all of that filled up. But we also just need to make sure that we do more than just that. I'm concerned about sports arenas, the corridors, the washrooms, etc. A good first move. It's just not sufficient to achieve what we need to achieve.
Are you stopping short of like a full lockdown?
No, it wouldn't be a full lockdown. That's the point.
That's what I mean. Yeah, it's not a full lockdown, right? Sorry, go.
That's the point. What we would look at is no curbside pickups, no restaurants closed, etc. It would be that we need to decrease consistently capacity. And of course, this also just holds for private gatherings. That's the point. If we want to avoid that case numbers continue to go up and double every 3 days or so for Omicron, then we need to react relatively swiftly.
And what if this doesn't happen, what you're recommending? What are the consequences in Ontario, potentially?
Well, it can look very challenging. No, our ICUs will get overwhelmed then, our hospitals will get overwhelmed, and we will make it, to the next level regarding case counts. We need to be aware of that. This means testing won't work properly anymore. There are a lot of aspects.
Well, I want to talk about ICUs in a second, but, people are exhausted by this, right? And nobody debates that, and it's not news to you. How do you think people would react to that, to what you're suggesting? Do you think people would follow those rules, or are people so fed up at this point? I see you making the prayer with your hands, but, you talk about mental health, right? People are suffering now, right?
But you see, that's the point. We need to change our attitude. What do you do if you're on a beach and the tsunami is coming? You tell me. You say, oh, there's no tsunami. No, you can't. We need to change our attitudes. What's the problem with going back to 25% capacity in a restaurant? Life will continue. We need to stop moaning, face the reality, and do the right thing. It's as simple as that. This needs leadership. This needs a bit of discipline. What is the problem if we have 7 people gathering for a Christmas dinner rather than 25? You can enjoy yourself among these 7 people. If we don't do the right thing, we will pay it dearly, and we need to be aware of that now. It's about the virus. It's not about you or me. It's just the virus. The virus doesn't care about you or me.
Speaking of the virus, and you talked about the potential for ICUs to be overwhelmed because of Omicron. One of the things, and we're still learning about Omicron, but one of the things we think we know is that it's not as strong as some of the previous variants, not as virulent as, let's say, Delta. Highly transmissible, right, but not as virulent. So how does that that you're not going to get as sick? So how do ICUs get overwhelmed Do you know what I'm saying? I'm just saying what people think.
No, I'm about to lose it, I can tell you. I've answered this question now for the last 3 days about 50 times. The point is, and this is not personal between you and me, but we just need to be aware of it.
Agreed, yeah, but please explain.
So let me explain once more. The situation is as follows. We have so much potential still for ICU admission in this province because of so many people being unvaccinated that, given the rapidity that this has, the speed that it transmits, we would need to have a virus that is 10 times less virulent, that our healthcare system would be able to deal with the ICU admission still. If it's less than that, and it's biologically implausible that it's 10 times, then we have a problem. And then the rest is just that ICU admissions follow, the case counts at the lower level perhaps, and this will probably happen, but it's not enough. What we see in South Africa is, and that's great news, that there is probably less mortality, which could be great news, for instance, for our long-term care homes. It's less mortality for people who are at least partially immune because they're either vaccinated or have had an infection. And that's the point now. We need to be aware of that. If we hide behind it's less virulent, we delude ourselves because we ignore the facts of exponential growth. It's as simple as that. So when we continue to perseverate with that part, then we're just clutching at straws, and it doesn't help.
Very quickly, your main message to people then as we head into the holidays.
We can do that. We need discipline. We do the right thing. We know what the right thing is. We need to see less people in a high-risk setting. We go for a walk, etc., etc. We need to make sure that we don't end up in crowded spaces anymore, indoors. That will all help. We need to be pragmatic here and use rapid tests well, mask up well, get our booster shots. All of that helps. We can do it if we're a bit disciplined and then, just gain a little bit of time. But if we just continue right now and don't do anything, it won't end up well, but really not.
Dr. Jüni, I appreciate your time and your frankness and your passion. Thank you.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.